I want to acknowledge we're on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nations. Yesterday, Elections BC completed the final count from the October 24th election, and the results have confirmed that British Columbians have chosen our NDP team to keep BC moving forward together. We have a strong mandate to make sure that we get through this pandemic safely and effectively, and that's going to be our commitment going forward. It's humbling to have the support of 48% of British Columbians. It's humbling to have the prospect of having 56 colleagues join me here in the legislature. Yesterday, I spoke with Lieutenant Governor Janet Austin. She has asked me to form a new government, and we're in the process of going through that transition, and we'll be announcing a new cabinet and a new government in the days and weeks ahead. In the last 2 weeks, we've seen a dangerous increase in COVID-19 cases, particularly in the Lower Mainland. And we need to make sure that we keep essential services functioning, surgeries, schools, and others operating as safely as possible. All of this is at jeopardy if we don't continue to focus on working together, each other, taking our responsibility to bring the case numbers down. We need to have targeted action. Dr. Henry has announced that over the past couple of days, and she'll be available later this afternoon to talk about those in detail. But over the next 2 weeks, we need to reduce our social contacts, and we need to make sure that we're staying local and reducing to only essential travel. We need to make sure that indoor physical activities are under a new safety plan. That means reinvigorating the work that's already been done with Public Health and WorkSafe BC to make sure we're narrowing in and following the science on these important questions. Our objective is to make sure that workplaces can be safe. Our objective is to make sure that our economy can remain open. But if you're sick, you need to stay home. If you don't know people that are gathering with you, you need to find another way to gather. These are really critical issues. Dr. Henry's made it abundantly clear. If we're going to get through this, we have to follow these basic directions. And with respect to workplaces, again, we need to follow the science. It's clear that we've seen significant outbreaks in Fraser Health and in Coastal Health in the Lower Mainland. But we've also had cases in Interior Health, cases in Northern Health, cases on Vancouver Island. But focusing on this regional approach, I believe, allows us to refine the practices that we put in place and make sure they're appropriate for where we are in the pandemic today, coming into what is clearly a second wave as we look at influenza season and the winter break that's coming. So we need to make sure that we're transferring more inspectors to Public Health, and we will do that. We need to make sure that WorkSafe is focused not just on employee safety, but patron safety as well. And we need to create ways to ensure that we are reducing risky behavior, reducing workplaces that have risky behavior, and we do that through, I believe, through hoping for compliance rather than rigorous enforcement. But enforcement is key and a vital part of the work that we will be doing in the weeks ahead. I also want to just take a moment to talk about our school system. It is important for kids, it is important for community that our school system remain open, and we have not seen any serious transmissions in our system since we reopened in September. But we need to be vigilant, particularly when case counts start to spike as they have. Bringing COVID-19 into our schools is something that we all need to guard against. That includes parents, that includes teachers, that includes support workers as well as administrators. And I understand that the Labor Relations Board will be making recommendations on putting in place a new troubleshooting process within our K-12 system. I'm very excited about that. It has my full support so that we can bring the stakeholders together on a more regular basis to target any challenges that we may see and work on resolving them as quickly as we possibly can. With respect to testing, you'll be aware, Minister Dix and Dr. Henry have been talking about this a lot. We are on track to get our capacity up to 20,000 cases, tests per day in November, and we're going to continue to streamline our processes so that those tests can come back as quickly as possible and the delays are as little as they can possibly be. We're also going to be using the tools of government to amplify Dr. Henry's message through online and TV advertising, information being made available in multiple languages, as well as using social media to connect with those who don't watch the news or read the daily papers. That's going to be the route to our success, working together. Minister Dix and I and others have been talking with leaders in communities throughout the Lower Mainland to make sure that we're all on the same page. If we're going to get back to our envied position at the start of this pandemic, we need to ensure that we're all working on this together. The challenges are grave and they're significant, but I'm confident that if we focus on each other and focus on our communities, we'll come through this stronger than we went into it. Happy to take any questions anyone may have. Thank you.
Good afternoon, everyone.
New jacket.
Thank you for joining us today. We'll have questions. If media have questions, please hit *1 to get in the queue. To start things off, we have Binder Sajan from CTV. Binder, please go ahead.
Hi, Premier. I just wanted to kind of go back to what you were talking about there, that schools and businesses could be impacted if people don't start or don't abide by these new regional requirements here. And I'm just wondering if you talk a little bit more about what potentially is at stake. Would it be returning to stage 1 restrictions, which essentially was a lockdown?
Yeah, that's the end result if we don't start to see these numbers come down. We have had success in the past using influence within communities, talking to people about how they should behave, reducing the number of faces and making sure that we have larger spaces for gatherings. But as we come into the winter and the rainy season and in the south, and of course snow and cold in other parts of British Columbia, we're going to find ourselves going indoors more frequently. And that's where we really have to guard each other. And our focus is to make sure that we keep our economy open and keep it functioning safely. We believe we can do that, and we're redirecting resources within government. We're going to make sure that inspections, for example, by WorkSafe are not just about I'll use restaurants as an example, not just about the restaurant and the staff within the restaurant, it's also about the patrons that are frequenting that restaurant. We need to make sure that everyone is safe, and that means pairing up public health officials with WorkSafe inspectors and other inspectors that are available to us, whether they be bylaw officers in communities or others. And that's how we're going to drive the curve down again. And we want to do that by keeping the economy open to the greatest extent possible, but it is going to require people to get with the program. And there's a whole bunch of people that are not abiding by the minimalist rules we had in place, and that's why we've seen the regional issues that Dr. Henry brought forward this week, and she'll be able to expand on those later today.
Binder, follow up?
Yes, just on that note, I know that there was a directive for public sector employees to go back to work part-time. I understand that's not happening now in the metro region. Just wondering, what's your perspective on that? Do you think that policy was maybe came out too quickly?
Well, we're following the science. When we made the directive to bring people back to government workers back to their workplaces, it was done at a time when cases were relatively low. And on Vancouver Island, for example, cases are still low. But we'll be directed by the science what the evidence is that Dr. Henry receives and then how she presents it to us. But we are certainly very flexible on these issues, as we have to be. I don't think that British Columbians want us to hold rigidly to positions that have been proven to be inaccurate based on the evidence that's before us. And currently, we're slowing down the return to the workplace, certainly in the areas where the orders are affecting people. But we're going to keep watching that and monitoring it on a regular basis. We need to make sure everybody's safe, but we also need to make sure all the work's being done. And we've been very successful working remotely and using technologies to bring people together. We're going to keep doing that until the science tells us otherwise.
Next, we have Richard Zussman from Global News. Richard, please go ahead.
Minor, can you explain to us what this Labor Relations Board tool is going to be? It seems like you just mentioned it in passing, and it could be quite substantial. What is the shift going to be there in terms of tools for schools, and does that include teachers and parents? And can you give us a breakdown of that, please?
Yeah, I want to await the ruling from the Labor Relations Board chair. That I don't have it at my disposal, but I understand that there was an issue brought to the Labor Relations Board by the BC Teachers Federation. There have been discussions about perhaps a better way beyond tribunals and beyond the collective agreement to address these issues. I'm very excited about that. We were able to make successful changes to operating practices in our schools because of that collaborative approach. And I want to get back to that. And that means rapid responses when we see issues within our classrooms, whether it be brought forward by teachers, by parents, by support staff. We want to make sure that we have mechanisms in place to ensure that we act swiftly. That's the objective. And I think we're going to get direction later in the day from the Labor Relations Board in that regard. But I'm confident, based on the discussions that have been held, that a lot of people want to go in this direction. And I think it's the right way to go. Our intention from the beginning was to make sure that we had a collaborative approach so that all of the stakeholders involved in our K-12 system were comfortable with the direction we were going. And we need to keep doing that. I've said that from the beginning, that the plan for today may not be the plan for a month from now. We need to always follow the science and listen to people in the sector so that we can get the best information possible. I believe that's where we're going with respect to the Labor Relations Board.
Richard, do you have a follow-up?
I do. And also, do you find, we've heard a lot of confusion. Are these new guidelines confusing? And what do you say to businesses who have gone over and above, put in measures, and now are being asked to close, even though there's been no outbreaks associated with their facilities? And how many people, as you mentioned, are being reallocated to new enforcement?
Well, firstly, on the question of the orders, every time a new order is issued, there are questions that are raised, and it's absolutely appropriate and legitimate. We do our best to answer those questions through public health, through other mechanisms. With government, we're able to use other tools like advertising and directly reaching out to people through social media to answer and resolve issues as they emerge. But we have seen evidence that some actors for example, spin classes or wherever there's intensive activity inside, we've seen an increase in cases. And that means we need to amend the work plan in those places if we're going to keep them open. And I think most businesses will say, okay, we were doing okay in our space. These are the issues that we've been dealing with. Engage with public health officials, engage with WorkSafe, and find out what improvements need to be made. But this is going to be challenging. Listen, no one should be under any illusion based on what's happening in British Columbia, in Canada, in North America, and around the world, that we're going to be out of this anytime soon. This is not, we're not designing plans to make life uncomfortable for people. We're designing plans to make it as comfortable as we possibly can by making sure that we can continue to have surgeries in our acute care facilities, by keeping our schools open so kids get the education that they need and that families can have a little bit of normal in their lives. But there's nothing normal about a pandemic. There's nothing normal about the challenges that we're facing. And that's why we need to focus on helping each other through this. We have a battery of programs that are put in place for small businesses to help them through as part of our restart plan, and there'll be more as we go into the budget process for next year. So I ask for people to be patient with each other and patient with government as well as we put in place what I believe will be the best outcomes possible for British Columbia.
Next, we have Tanya Fletcher, CBC. Tanya, your line is now open.
Premier, I want to talk about this regional approach we're seeing with this new round of restrictions. I know the province was overall a bit hesitant initially in the spring to move forward that way, but given Fraser Health, Vancouver Coastal Health targeted this time around, do you see this kind of framework maybe driving strategy moving forward as perhaps health officials and government are more nimble to react just specifically to geographical locations that are a problem?
Well, that's a good question, and it's a challenging one for me to answer because COVID is everywhere. COVID is in the north, it's in the interior, it's on Vancouver Island. People are still traveling. Essential workers are still traveling throughout all of the 5 health authorities and the Aboriginal Health Authority as well. And so I don't want people to think that because the orders are focused on the areas where we've seen the largest number of cases Fraser Health and Coastal Health, that means that the island and interior and northern health do not have to be vigilant when it comes to physical distancing, be vigilant when it comes to ensuring that people do not come to the workplace when they're not feeling well enough to do so. All of those issues remain in place for all British Columbians. But Dr. Henry's focus on Fraser Health and Coastal Health is a direct result of the inordinate number of cases in those areas. We need to make sure that we get those cases down, and that's why the orders are in place. She'll be able to speak to that in more detail later this afternoon, but it's my view that we need to make sure that we have a pan-BC approach to COVID-19, but we also need to be mindful that in this instance, a regional approach may well be the best one to get at the challenge, which is in Fraser and Coastal Health.
Tanya, for a follow-up.
Yes, please, thanks. And on that related note, you emphasized again only essential travel right now in those regions. The tourism industry, many of them have said they've been hanging by a thread already. So would they or could they expect more support for the tourism industry broadly as a whole if we see this continue?
Well, the tourism industry has been absolutely rocked by COVID-19. And again, it's a direct result of nobody traveling. It's not just British Columbians not going to sunny climes in the winter. It's people not coming anywhere. And so, I think we need to put all of this in perspective. We have outbreaks increasing in Europe, outbreaks increasing every day in the United States. British Columbia has seen an increase, but again, relative to other provinces in Canada, we're in a pretty good place. But we shouldn't be resting on our laurels. We shouldn't be complacent. We need to make sure we're doing our best to bend that curve again. With respect to tourism, we've known for months that this is a challenge, and we put in place programs. We put in place a task force at the request of the tourism industry, and we're going to keep working with the sector to make sure that government can be there to help them get through this. But until such time as people start coming back to British Columbia, that's not going to happen. And I think operators fully understand that. And that's why they're working rather than in any other way than collaboration. That's been the focus from the umbrella organizations in tourism. And that's also been how operators have approached this. Everyone wants to survive through the winter and get into the spring, and hopefully a vaccine and or therapies that will allow us to open our borders and have more people coming to British Columbia. But we are a long way from that today.
Next, we have Rob Shaw, Vancouver Sun. Rob, please go ahead.
Hey, Premier. You mentioned days and weeks ahead for your cabinet and the next steps of your government. Can you be a bit more specific on that? Is there a timeline that you have to name a cabinet, and are you recalling the legislature before Christmas?
There is a timeline I have, but I might not meet it. We do hope to bring the legislature back before Christmas. But we have, with the increasing cases in the past 10 days or so, that has challenged our ability to bring people together in Victoria for swearing in. We have 23 new members of my caucus, and I think there's a couple of new Liberal members as well. They're going to want to go through the whole deal about signing in and becoming MLAs. That has to happen, and then we have to swear in a cabinet. So I'm hopeful we can get that addressed in the next 2 weeks and then be in the legislature in December. But I can't be any more specific than that. I can tell you this, Rob, there are 2 months before the end of the year, and we plan to be very busy in both of them.
Rob, for a follow-up.
Thanks. Can you get the $1,000 grants to families out without going through the legislature? That election promise you mentioned as people needing before Christmas, is it possible to do that in some other way, or is that not looking likely based on the timeline you have before Christmas now? We want to approve the dollars through the legislature. That's the best way to do this, and that's our goal. But there are as you know, Rob, with government, there are always a range of options available to decision makers. My first choice is to recall the legislature, get this business done and passed for people, and then move on. That's the plan. And if we have to amend that plan, I'll certainly be at this podium or somewhere else letting you and other British Columbians know about it.
Next, we have Justine Hunter, Globe and Mail. Justine, please go ahead.
Hi, thank you. Premier, your colleagues in Alberta and Ontario have dismissed new restrictions on rising COVID cases. You've said here today your objective is to keep the economy open, but I'm wondering how you see BC in that spectrum of the balance between dealing with COVID with new restrictions versus keeping the economy open?
Well, we've approached this, Justine, differently than other provinces from the beginning, and we've had positive results. We are focused on following the science. We have Minister Dix, Stephen Brown, and Dr. Henry are an extraordinary team. They have spectacular resources around them, government workers, public health workers, and staff that are focused on making sure that we get this right. And our objective from the beginning has been to reduce the lockdown and expand our ability to operate safely. Dr. Henry's been crystal clear on that from the beginning, and that's why I believe we've worked so effectively together. And we're going to continue to do that. And I won't compare myself to other provinces. I don't believe that's helpful. I do know that our outcomes have been superior, and that's been a result, I believe, of the leadership we've had from public health, as well as our ability to talk to British Columbians about what's at stake and what's at risk. And British Columbians have responded, in my opinion, better than other Canadians by understanding that we're all in this together. And if we want to avoid the more onerous restrictions that are being imposed in other jurisdictions, we need to take advantage of the opportunities to find safe ways to operate, whether it be in the private sector, whether it be in the public sector, whether it be our schools, whether it be our post-secondary institutions. All of the elements of our community are working as hard as they can to get back to normal, and that's our focus.
Justine, for a follow-up.
Thank you. Just on the rent freeze you announced this morning, it's been extended to July. I understand the party position was that it would be extended to the end of 2021. I'm just wondering, is that kind of another shoe to drop yet to come, or are you just doing this as an interim measure till July until you've got a new government in place?
I think the easiest way to answer that is to say that this is an interim measure. This was the extent of the order that could be issued, and we've done that. But in order to have the freeze for the entire year of 2021, we'll have to extend that to September 2021, and then have that 3-month period of time for landlords and tenants to figure out where they're going to be going on January 2022. But that remains the plan, and this is let's call it an interim measure to get to that goal.
Next, we have Lisa Eusda, News 1130. Lisa, please go ahead.
Hi there, Premier. You talked about, how effective the response has been here and compared to Europe and to other places. But when people see 500 or more cases every day, I don't think they see it as very effective. So, when you see restrictions or curfews happening in places in Europe, France going to a full lockdown, why are we waiting? Why not take more stringent measures now? If that's the way, we're following our curve, why not take more stringent measures now?
Well, because we've only recently seen a significant increase in cases, and the science is telling us, Dr. Henry and her team are telling us, that we can manage this, in this instance regionally, over the next 2 weeks. And if these measures are inadequate, we'll look at other measures. That is how we've been operating from the beginning. And people will judge us by the outcomes at the end of the day rather than on a daily basis. And obviously, the election was an opportunity for people to have a say on the pandemic, and I spoke every single day of that election campaign about the importance of focusing on getting through this together. And that remains my commitment to British Columbians, and the government will be following through on that for the next 4 years, making sure that not only do we get out of the COVID-19 situation we're in, but also that we build an economy that includes everybody as we rebuild and build back to a place where British Columbians want to be. That's the mandate that I believe we've received, and that's what our focus is going to be.
Lisa, do you have a follow-up?
I do. Regarding schools, and you measured that there is this tool coming in place to ensure enforcement of the plan. I spoke to the education minister last week, and essentially he was saying, the frustrations that teachers have that it comes to the schools and school districts. Why was there not something in place at the beginning to ensure enforcement? You talk about WorkSafe and bylaw officers for businesses, but it doesn't seem that kind of enforcement to make sure that the provincial school plan was being and is being enforced in schools.
Well, again, we have said from the beginning that we needed to have a process that would evolve based on the inputs that we were receiving, whether it be from parents, from teachers, support staff, administrators, trustees, the whole range of people who are focused on K-12. And we are very fortunate to have so many dedicated professionals and parents who are focusing on making sure that the kids are safe and those that operate within the classrooms are safe as well. And this new tool will be a result of a labor relations process that was begun back in some months ago, and I'm confident that the outcome will be in to everyone's benefit. That's how I'm looking at it, and I have every confidence that all of the players want to keep working together. We have been very fortunate to have partners that, at the end of the day, are professionals that are focused on quality education for our children, and we are very fortunate in that regard. Now we have to just keep making sure that whenever there's an opportunity to improve on the plans, school by school, district by district, health authority by health authority, we're doing that, and that's the objective we hope to get from the Labor Relations Board today.
Next, we have Keith Baldry. Keith, go ahead.
Hi, Premier. You talked earlier about enforcement of these new rules. I'm just wondering, that's one thing people automatically ask, how are you going to enforce rules that are designed to keep people apart from each other? So can you walk us through how you see that being handled?
Well, it's not so much on how people are interacting with their SICs or within their family units that I believe is an enforcement question. I think that people have to understand that large weddings, large gatherings for end-of-life, celebration of life ceremonies is not appropriate at this time. In my case, my father-in-law passed away during the election campaign, and he lives in Ontario. My spouse wasn't able to go and see her family and be with them, but we utilized the technology that all of us are now so familiar with, and it was a very special couple of hours that were able to happen because we made it happen. And I think that British Columbians need to find ways to grieve, they need to find ways to celebrate, and they need to do it with smaller groups of people. And that is something that I think all of us understand at the end of the day. When it comes to enforcement, I'm thinking more about how do we make sure that the notion of party buses, I mean, the driver of the bus may be safe, but the patrons are not. So how do we manage that? How do we manage gyms and other dance studios and other areas where we have people doing vigorous activity in enclosed spaces? And that means making sure that we're helping operators ensure that their plans are contemporary, up to date with current health restrictions, and are able to operate safely. We don't want to shut people down. We don't want to issue tickets. We want people to act responsibly. We want people to be safe, and we're going to keep working on that.
Keith, for a follow-up?
Yeah, back to the $1,000 payment. Can you guarantee that will arrive in people's pockets and wallets before Christmas?
I can't, Keith. I can't guarantee that because I don't know what restrictions we'll have in terms of getting the legislature back into place. I have been advised by finance officials that once the dollars are appropriated, it won't take very much time at all to direct deposit the money in most cases because of the work we had done with the federal government on the revenue agency and how we're sharing information. So direct deposits are the best way to go, and we're hopeful that we can do this very quickly, but I can't predict when in December or early January that will happen, but I can tell British Columbians that the commitment we made during the election campaign will be fulfilled in the next number of weeks.
Last but not least, we have Les Lane, Times columnist. Les, please go ahead.
Oh, thank you. The pandemic was running 80% or so in Metro Vancouver and the Fraser region since day one, and I think since the case count started exploding couple of weeks ago, it's even higher. It's more concentrated in that region. It's never been clear to me that the simple fact that that's a huge population base fully explains why it is so concentrated in one region. It's not the only city in BC. What else is going on? Do you know?
Well, it's density. It's not just the populations, it's the space the populations are in. You've got the highest number of high density buildings. You've got the highest number of places where lots of people are working. in Kelowna and in Nanaimo, which would be, modestly sized cities. We haven't seen the same level, although Kelowna had an uptick in transmissions during the summer because of, again, people hanging too closely together. But my sense is, less based on the briefings that I've had, is that it's just the number of people and how close they are together. And that the challenge is keeping that number of people further apart. And that's the objective of the orders, and that's how we're going to proceed.
Les, do you have a follow-up?
What's the difference between the phenomenal success BC had in general for the first 6 or 7 months of this, and what I guess with the second wave that's now hitting, we're losing ground. It looks like it's running away on you. Is it just sloppy compliance, or is there an explanation for the difference between the first and second waves?
Well, again, I think there's a couple of answers there, Les, and Dr. Henry would probably be better to answer them in terms of what's different between February, March, and today. But from my experience, when Dr. Henry and Minister Dix briefed me on the state of COVID-19 and what we could expect, we had little or no understanding of how the virus would act, what our capacity was to manage it, and there was, because of the significant outbreaks in Italy, particularly, and then in New York City, and then of course just south of us in Washington State, it focused the mind of British Columbians, and so we responded as a community very effectively to the directions to keep your distance, do not go to work sick, and all of the other issues that we know now so well. We were vigilant as British Columbians, and that started to lapse into the summer. We weren't seeing the same level of focus in other parts of the world on COVID-19, but now we've seen a resurgence in every corner of the globe, and British Columbians now need to react as we did in the past if we're going to be successful. But again, Dr. Henry can tell you the difference between what we knew in March and what we know in November far better than I can, Les, and I know she's available to you later today and many, many other times going forward. But my gut told me that we reacted as British Columbians as champions. I was so proud of our ability to buck the trend and listen to public health orders and keep communities safe. Regrettably, still hundreds of people lost their lives, and that disrupted families. It's impacted the economy. All of those things remain challenges for the incoming government, and we're going to manage them as best as we can.
Thanks very much. This concludes the press conference.
Thanks, everybody.